Alexis is here back in our procedure room with Dr. Ordon and his assistant Megan. And Dr. Ordon apparently has a cool solution for a square-shaped face.
A very cool solution. That's right. I'm here with my lovely assistant Megan from the office at Roxbury Clinic and Surgery Center. And you already met Alexis. She's right here, and she's lovely. But I am going to show you what's bothering her. Now, a square jaw is a good thing. But in Alexis's case, she actually has, and I'm removing the topical anesthetic that I've had on here. She has this bulge, which is due to her masseter muscle, that muscle that we use to chew. It fixes on your cheekbone, down to your jaw. That's how you chew. In her case, she says she does grind her teeth, has some TMJ problems. That's why that it's enlarged. So bite down for me. Do you see that? You see how she has that bulge right there? We're going to treat that. How are we going to do it? With some Botox. Can I have the marking pen? So what we do is I mark the angle of her mandible, which is right like so. Now I know the marginal mandibular nerve is going to be about 1 finger breadth above that coming in here. Flex one more time. So what I want to do is mark above that point. And I want to mark what we call the insertion of the muscle. Botox, Megan, please. I'm going to use 20 units per side. So she's been previously numbed with just topical anesthetic here. And this is an injection just into the muscle per se, okay? All right, so we know how Botox works. It's going to take 24 to 48 hours for this to set in, right?
So we won't see results here today, but within the next few days, Alexis will see a significant difference, Dr. Ordon?
Right, and Alexis' first question, she asked me a second ago, how long does it last? It lasts anywhere from 3 to 6 months. So we're done here. Megan, thank you very much. I'm going to wipe her marks off here. I'm going to put a little pressure, but you can see that. No bleeding from this injection.
So is this in some ways, like Dr. Ordon, let's just say, take a bicep muscle. If you injected Botox into a bicep muscle, it wouldn't be as bulky, right?
That's exactly right,
so
Travis, because what we're doing is we're blocking that interface of where a nerve comes into a muscle. So that's where we're blocking at her. Of course, she's still going to be able to use that muscle, but just less. This will definitely soften that full look for her. And in her case, it's not just a square jaw. She actually has that bulge from an overactive masseter muscle. For Alexis, it's going to take a couple days to set in. So let's take a look at some before and after pictures, what she can expect down the line. Now look at that. This woman has that mesenteric hypertrophy. You see that at the angle of her jaw. And then after a treatment, similar to what we just did here, about 20 units of Botox per side, that's the way that she'll look once everything sets in.
The only difference is in Alexis's after, we're going to have her smiling. Alexis, are you excited?
Yeah.
Thank you, Dr. Ordon and Megan. Alexis, best of luck to you. Thanks for being with us.
Thank you for having me.